This morning in Be Smart, Be Well, we're talking about metabolic problems in children. Dr. Emily Cooper from the Diabesity Research Foundation and author of The Metabolic Storm joins us now to talk more about this. So we've all heard that, you should eat breakfast and shouldn't skip that part of your day.
Right.
And that applies to kids as well, right?
It really does. This recent study about skipping meals really shows that kids who skip breakfast actually have a higher rate of metabolic syndrome as adults. And why this is important is that metabolic syndrome includes high blood pressure, high cholesterol, more deep belly fat, prediabetes, and even type 2 diabetes. And then it turned out that there's another study showing it's not just kids that are affected. It's actually adults that skip meals that are also at higher risk for metabolic syndrome, type 2 diabetes, and inflammation. So we think it's harmless, but it really isn't.
And especially if you think about dieting, you think, well, I'm just going to skip that meal. That's going to help me with caloric intake.
Exactly.
That actually backfires.
Yeah, it really can.
So another study revealed some surprising results in terms of athletes. So student athletes, which you would think, okay, among, a group of healthy people, they would be the healthiest, right?
You would think that. But what was really interesting is that researchers have been looking at student athletes that are in the adolescent age range from Mississippi and Philadelphia. And granted, those are high obesity areas. But what they found, they identified very high rates of obesity and high blood pressure in that group. In fact, 44% of the kids that were the athletes were either in the overweight or obesity weight categories, and 15 to 21% had high blood pressure. And what's interesting is the CDC reports rates that are actually not as high in the same age group, same geographic areas. So it was pretty alarming.
So do you know why? What's behind that?
Well, that's what's interesting. It got me thinking. I was thinking that, well, since if kids skip breakfast and they're at higher risk for metabolic problems, and we know that underfueled exercise can impair your metabolism, there may be a link there. If you both combine skipping breakfast and then you're exercising with underfueling the exercise. And the other issue is that studies show that as few as 35% of pediatric medical visits really includes an adequate assessment of blood pressure. So it could be that these diagnoses are really underreported, and that's what the CDC goes by.
So whether or not you're a student athlete or you're not a student athlete, you should get your blood pressure checked?
Yes, and you would think that kids who are athletic, even athletic kids that seem to be the picture of health, we're finding out that they're at risk for what we used to think of as just high-risk adult diseases.
So in terms of what we can do to protect our kids from these issues, whether or not you're an athlete, obviously not skipping breakfast, not skipping breakfast, meals.
Having meals together, fueling exercise appropriately, eating throughout the day, carbohydrates, proteins, and fats, of course. And if you're the parent who brings snacks to practices and games, make sure you bring enough for everyone. The other thing is when you take your child to the pediatrician, make sure that they're actually checking the blood pressure and ask about it, because it's not just a simple number as it is in adults. You actually have to look at it relative to the gender, so boy or girl, and where they fall in the height range and their age. And so there are different normal levels based on those parameters.
Right, okay, great information, especially as kids head back to school at the start of the school year. Dr. Cooper, thank you. And we'll put all of this information on our website.